Osteoporosis is generally silent until there's a fracture of the wrist or the hip or maybe a vertebral body, and then it's too late. So you need to know these risk factors. The risk factors are increasing age, being a postmenopausal woman because estrogen is somewhat protective, being white or Asian puts you at a higher risk than being black, smoking increases your risk, poor calcium and vitamin D intake, glucocorticoid use, lack of weight-bearing exercise is a risk factor. Being thin also increases your risk. This is one of the few health advantages that overweight and obese people have over the thin. When you're heavy, you're definitely subjecting your bones to more weight-bearing exercise just walking around. So being thin increases your risk of osteoporosis. How do we diagnose osteoporosis? Well, this is done with a test called a DEXA bone density scan at the lumbar spine or at the femur. Now, DEXA stands for dual energy X-ray absorptiometry. I won't get into how it works because we're already getting pretty far away from anatomy. Then to treat osteoporosis, there are lots of different medications, but the mainstay of treatment is a class of drugs called the bisphosphonates. You may have heard the brand name Fosamax, which is a bisphosphonate called alendronate. That's the generic name, alendronate. So all the bisphosphonates, like alendronate, work by inhibiting osteoclasts. So you're inhibiting the demo crew, which is going to favor bone construction overall. So treatment is a little beyond what we want to discuss here, but you should kind of tuck that away for later. Osteoporosis, bisphosphonates. So that's it for now. Let's get back to Dr. Phelan and talk about joints.
Motion of the skeleton occurs at joints, which are places where bones come into contact or articulate with each other. The three main categories of joints are fibrous, cartilaginous, and synovial. Fibrous joints are named for the fibrous connective tissue that holds them together. The three types of fibrous joints are sutures, syndesmoses, and gomphoses. Suture joints are only found among the bones of the skull. They lose their mobility after birth and usually eventually fuse. The articular surfaces of the bones of the suture joints may be serrated and interlocking, wedge-shaped and overlapping, or simply smooth and abutting each other. Syndesmoses often allow some motion. The fibrous connective tissue that binds them includes interosseous membranes in some instances. These include the joints of the bones of the forearm. Gomphoses are the joints between teeth and their sockets. Fibrocartilage, which is made up of collagen and other connective tissue components, binds the bones involved in cartilaginous joints together. In primary cartilaginous joints, or synchondroses, the bones are united by a plate of hyaline cartilage and usually ossify with age, as in the epiphyseal growth plates at the ends of the long bones. Secondary cartilaginous joints, or symphyses, usually feature a cartilaginous disc between the bones, such as the intervertebral joints, or the pubic symphysis. Synovial joints, such as the elbow joint, have a fibrous capsule derived from deep fascia that usually attaches firmly to the ends of the bones involved in the joint by blending with their periosteum proximal to their articular surfaces. Adjacent ligaments often blend in with the capsule to thicken and strengthen it. On the internal surface of the fibrous capsule is a synovial lining that secretes a lubricating synovial fluid that reduces friction between the articular surfaces of the bones forming the joint. The synovial lining does not cover the articular surfaces of the bones, which are instead covered by hyaline cartilage, which is thought to be nourished by the synovial fluid. There are 6 types of synovial joints. The bones forming plane joints, such as the sternoclavicular joint, have relatively flat articular surfaces that allow them to glide across each other. Hinge joints, like the elbow, allow only flexion and extension. To envision a saddle joint, consider mirror images of a saddle and twist one saddle 90 degrees so its convex surfaces line up with the other saddle's concave surfaces, allowing the two saddles to fit together. This joint allows motion in 2 axes, such as flexion and extension, and abduction and adduction, as well as the sum of these actions, which, as we mentioned earlier, is circumduction. The first carpometacarpal joint, where the thumb attaches to the hand, is the standard example of a saddle joint. The same actions are possible across a condyloid joint, in which one articular surface is convex and the other is concave. The first knuckle joints, or metacarpophalangeal joints, are condyloid joints. Ball and socket joints, like the hip joint, feature a very convex-shaped head of one bone fitting into a very concave, socket-shaped receptacle on the other. These are very mobile, multi-axial joints. In a pivot joint, there is a central bony axis on one bone around which another rounded bone rotates. The best example is the atlanto-occipital joint, where the posterior arch of the atlas, or first cervical vertebra, articulates with and rotates about the vertically oriented odontoid process of the axis, or second cervical vertebra. Synovial joints receive a substantial vascular and nerve supply. Arteries often form anastomoses around joints, that is, connections among arteries without an intervening capillary bed. This ensures adequate blood supply across the joint if changing the angle of the joint compresses one or more of the arteries crossing it. Hilton's law states that nerves innervating the muscles acting on a joint give sensory branches to that joint, as well as to the skin over the area of attachment of these muscles. These sensory nerves are involved in transmission of pain from the joint capsule and any associated ligaments, and, to a lesser extent, from the synovium. They are also involved in proprioception, a sensation that allows awareness of the position that the joints are in.
Let's talk just a second about a disease of the joints called degenerative joint disease, or DJD, or another name is osteoarthritis. Now, arthritis just means inflammation of the joints. Itis means inflammation, so if you have inflammation of the sinuses, that's sinusitis. If you have inflammation of the appendix, that's appendicitis. If you have inflammation of the joints, that's arthritis. Now, there are lots of different specific types of arthritis. We're going to talk about osteoarthritis here, which is the most common type of arthritis out there. Unlike autoimmune arthritis, like rheumatoid arthritis, where the patient's own immune system attacks the joints and tears them up, with osteoarthritis, it's caused by what we call wear and tear on the joints. Now, Dr. Phelan mentioned how the ends of bones are covered with an articular cartilage, and then synovial fluid reduces the friction between the articular surfaces of the bones. Osteoarthritis occurs when there's destruction and erosion of the bone's articular surface. The disease occurs primarily in the hips, the knees, the vertebral column, and the hands, but it can also occur elsewhere. Osteoarthritis comes on very gradually, and depending on the severity and the progression of the disease, you can treat it with Tylenol or non-steroidal anti-inflammatory medications. You can treat it with steroid injections into the joint space, and also joint replacement. Now, we've mentioned briefly rheumatoid arthritis and also osteoarthritis, but there's another type of arthritis called septic arthritis. Remember from the lecture that synovial joints receive a substantial vascular supply, and because of this, bacteria can infect the joint from the blood. So we use the term septic arthritis to refer to a bacterial infection of the synovial fluid of a joint, most commonly through hematogenous spread. However, it can be from direct insertion of bacteria from surgery or from trauma. Now, in septic arthritis, you have a very painful joint which comes on very suddenly and very quickly, not like osteoarthritis. And there's normally a fever with septic arthritis. If you suspect septic arthritis, you're going to need to insert a needle into the joint and pull out some synovial fluid and see what's causing the infection. Staph aureus, streptococcus, and Neisseria gonorrhea are common bacteria that cause septic arthritis. A common clinical situation is a young person with a sexually transmitted infection who develops an inflamed knee, which would suggest septic arthritis caused by Neisseria gonorrhea. So that completes our discussion on the connective tissue and the bones and the joints. Now I want you to pause the video and answer the end of session quiz questions, and we'll go through those answers together. Let's get going. First question, what's the function of bursae? Well, these reduce friction between the body and hard surfaces that the body may come in contact with. Next, what are the 5 main classifications of bones? So you have long bones, short bones, flat bones, irregular bones, and sesamoid bones. Next, what are the 3 main categories of joints? Well, there are fibrous joints, cartilaginous joints, and synovial joints. Next, what are the 3 types of fibrous joints? So you have sutures, syndesmoses, and gomphoses. Next, what type of joint features a cartilaginous disc between the bones, such as the intervertebral joints? This is a symphysis. Okay, we're almost done. We've provided some images for you to label and also some different joints where we want you to classify the type of joint. So label the images as they come on screen and classify the types of joints provided, and then we'll be finished. Thanks.